tell us exactly what does a CVTS surgeon do?
So that's a very interesting question. A lot of people ask that what exactly does a cardiovascular thoracic surgeon do? So we operate on the heart, so we operate on cardiac cases, we do thoracic cases of the lungs, and then we do vascular cases and something else as well, as I'll tell you about it. So starting from cardiac cases, the most commonest surgery that we do is a vascular bypass. Everyone must have heard about this. A patient has a heart attack, angiography is done, and there are multiple blockages. And then we need to go in, and these are the blood vessels which develop those blockages, the ones in red. So we do a bypass to these blood vessels. So this is the commonest surgery performed. Next is we operate on the valves. Now valves, the heart is made up of 4 chambers. Inside the chambers there are doors which let you from one chamber to another. These are called the valves. If anything happens to the valves, we will either have to repair or replace them. As you can see in this figure, these are how the valves look like, and this is a new valve which has been put. So we do these valve replacements as well. Then we go on to aortic aneurysm surgeries. Now what's the aorta? This is the biggest blood vessel supplying the blood to the heart. Sometimes this great swelling develops in this. As the swelling increases in size, there is a chance that it can just rupture and pop off, and that would be the end of life. So these need emergency treatment, and we do this aortic aneurysm and dissection surgeries as well. Next we go on to a hole in heart. You must have heard of people being born with a hole in heart. These are small holes which need to be closed. We do those as well. Sometimes there is a tumor mass inside the heart. These are called myxomas, and they need to be taken out. These surgeries are done by us as well. Last is a pericardiectomy. Now the heart keeps beating and it is surrounded by a sac. That sac is called a pericardium. Sometimes the sac which surrounds the heart and protects it becomes thickened due to some disease like tuberculosis and starts constricting on the heart, and the heart is not able to beat. So now this sac must be removed. The surgery is called pericardiectomy. We do that as well. Next we go down to something which we did a lot during COVID, which is called as an ECMO. It is an artificial method of maintaining your circulation. If the heart is weak or the lungs are weak, we supplement them by putting the patient on an ECMO. Now as we go on to the worst case scenario, where after everything the heart cannot be salvaged, the heart is really very poor in function, we go on and either we put in an artificial heart which is called as an LVAD, or we do a heart transplant. After this, let's go on to the thoracic part. In thoracic surgeries or surgeries on the lung, we do something called lung biopsies. Then in certain lung infections, the infection encases the lung and the lung just collapses. Now we have to open up the lung again. This surgery is called decortication. We do that as well. And in certain cases like tuberculosis or fungus of the lungs, a part of the lobe, or in tumors may have to be removed. A part of the lung has to be removed. This is called as a lung lobectomy. We do that as well. Now going on to vascular now. In vascular cases, if we operate on all the blood vessels in the heart, if there are blockages in the blood vessels in the heart, sometimes we need to take out the blockage and repair the blood vessel. If it cannot be repaired, we have to bypass the blood vessel blockage. The blood vessels supplying the blood to the brain, these are called the carotids. Sometimes they have a significant blockage here and we have to remove this as well. So this is also called carotid endarterectomy, which we do. Now the blood vessels supplying the hand and the legs, if the clot develops and occludes the vessel completely, the blood flow is restricted. So we will have to go inside and remove the clot as well. This is called as an embolectomy. We do that as well. We do diabetic foot surgeries. Now you have heard of patients who are on dialysis. Now for dialysis, they need something which is called as an AV fistula, which is done in the hand, either here or here. So these AV fistula creations are also done by us. Now coming down to a very important structure called the diaphragm. This is your chest and the abdomen, and it is separated by a structure called as a diaphragm. This diaphragm is the muscle which helps you in breathing. Sometimes due to trauma, you can have a laceration of the diaphragm, very commonly seen in this car accidents where the steering wheel just comes and hits your chest and the diaphragm ruptures. So these things have to be done on an emergency basis, the repair of the diaphragm. So all diaphragmatic surgeries as well as trauma surgeries are done by us on an emergency basis. Apart from all of these, a cardiac surgeon is always there in the hospital whenever any other department has a problem, be it a gynec problem, be it general surgery, ortho, the liver team, the liver transplant team, or the renal team. We are always there to salvage the patient. Thank you. Thank you so much. So, if you have any of these problems, you should come and visit a cardiac surgeon. We are always there at Dr. L.H. Hiranandani Hospital.